Speaker intervention is Jo Cozens, also speaking Branwen Mann. So if I can please invite Jo Cozens to come and speak, and then we'll give the floor to Branwen Mann.
Hi, thank you very much for inviting me here today. My name is Jo Cozens. I have epilepsy and a son affected by valproate. To begin, I'm reading a statement from Facts Aware, written by Emma Friedman. Facts Aware is an online awareness campaign. It's a conversation that anyone can take part in. We work with the Yellow Card team at the MHRA to promote the safety use of medicines and the importance of reporting adverse drug reactions. Our next event is Choice Unlimited Rutland on the 11th of October. The MHRA Valproate Toolkit is brilliant, and it's been a pleasure to take part in its development. For those who haven't seen it, this is the toolkit. We would like there to be also a symbol of a pregnant woman with a red circle strike through on the outside of the box. And this is what France are developing, and I would like to see it across Europe. Currently, this is what we've got on our boxes in the UK. And as you can see, there's a big difference. The distribution of the toolkit has been very disappointing. The UK Department of Health restructure and privatisation of the NHS led to a fragmented services and chronic staff shortage. The British Medical Association of College of Nursing have raised patient safety concerns due to 450 GPs and 20,000 nurses leaving the profession in the last 3 years. This leaves 1 million patients without a named GP. Some of them will be women taking valproate. Patients wait weeks for a GP appointment, and more important, seen by a locum who they haven't even met before. Doctors are not routinely reading drug safety updates and NICE guidance. Pharmacies have cards that have been printed out, very flimsy small cards, but unfortunately they haven't received these either. For females fortunate enough to have a conversation with their GP, there isn't any information about how valproate syndrome presents and what to do if it is suspected in women's children. Sanofi have a loyal bunch of clinical experts promoting valproate and resisting warnings. I can see a few in the room today. You know who you are, and we don't trust you anymore because you are complicit in avoidable injury to children. We are hopeful that phenytoin, carbamazepine, Cevira, Seroxat, breast implants and mesh and joint replacements can be given the same level of scrutiny by the European Medicines Agency in the near future to ensure patients have informed choice about treatment options, preventing suffering, improving lives. Facts Aware, thank you.
Well, thank you very much, Mrs. Cozens. Shall we go straight to hear from Branwen Mann?
I'm now speaking on behalf of Oaks as
You're
well.
You're speaking. Good.
Yes, okay. Good. So our survey shows that most women given valproate were under the impression that it imposed insignificant risk to the unborn child and accepted these risks were negligible. 1 to 2% chance of a baby being born with spina bifida and cleft palate. No mention of developmental delays and autism, just to take folic acid. It is clear that these women would never take a risk involving a 10% chance that their child will be born with major minor congenital malformations and 40% risk of a developmental delay. The NHS has completely different systems within their local authorities and also devolved governments. CCGs received the details over 1 year ago regarding the updated risks of valproate. CCGs also as well are slowly sending out toolkits and cards by email. Healthcare professionals are too busy to read the alerts and they do get email fatigue. Toolkits have recently been received by healthcare professionals without guidance on what to do with them. due to poor response of the toolkit only reaching 30% of women, a mandatory requirement that all healthcare professionals should review all women of childbearing age to ensure that they're all given informed choice. And if it's safe to do so, change the medication. Pharmacists suggest there needs to be a symbol on packaging, like the one I've showed you there, and there also needs to be valproate done as a red-like medicine for women of childbearing age. This is a clear system that pharmacists can see. And also as well, consultants who undertake the risk of mitochondrial medicine. The toolkit should be advertised in all waiting room display screens with informative leaflets as mandatory. Patient organisations should be included with their contact details also on the toolkit. Valproate has cost the EU health system billions due to adverse effects. There are over 20,000 children affected by valproate in the UK, most have autism. The London School of Economics and the Autistic Society have calculated to look after one child alone with moderate to moderate autism cost the welfare health education system up to £1 million. And that equates to over £20 billion being spent by taxpayers in the UK, and while Sanofi get away scot-free. Sanofi are here today at this public hearing, and if Sanofi feel that they are not accountable, to move forward we need to have complete transparency. Sanofi needs to share the thousands of confidential report pages that all laboratories are required to submit to the National Agency for Drugs each year. By doing that and presenting it to the committee and other medical staff here today, all effects of valproate reported from around the world are noted, and we respect data protection, obviously, to take people's details out. But is the turnover of a pharmaceutical giant like Sanofi more important than the health of all of our children? Thank you for letting me speak today.